welcome to the Stronger After Stroke podcast. I'm your host, Rosa Hart, and today I'm joined by a pelvic floor therapist, Lisa Cecil. Thank you so much for joining me today.
Happy to be here.
So you might not think that this has anything to do with stroke because strokes happen up in your brain, but they affect the whole body, don't they?
Yes.
Definitely. So Lisa, in your experience and from what you know, because you are very well studied in this as well, what are some things that people might experience after a stroke that a pelvic floor therapy session might help with?
Great question. So sometimes after a stroke, one might experience an increase or a sudden onset of urinary incontinence or fecal incontinence or even pelvic pain.
And that means that they can't make it to the bathroom without having a pee accident or a poop accident, right?
Yes, exactly.
Just want to make sure everybody
involuntary loss of bowel or bladder.
That's how we say it in fancy words.
Right, yeah. And then pelvic pain can be a variety of things, and that can be from any number of reasons due to the stroke, such as spasticity, because you have a bunch of muscles down there that no one talks about, or maybe a difference in hormones, or so it can change your sexual experience, which could be pain. So a lot of different reasons you could have pain.
Yeah. So would you say there are any differences between what you see people for pelvic therapy for if they have not had a stroke versus if they're having issues you can help with when they did have a stroke?
Yeah, there are definitely some differences. I think there's an increase in your ability to make it to the bathroom on time if you have some increase in physical disabilities, or a difference in your awareness of that loss of bowel and bladder because of sensation differences or cognitive differences, or your inability to express your need for assistance sometimes in the bathroom or in order to get to the bathroom. So things like that, I think, make it a little bit different, right? So we might work with another physical therapist, like a neurological physical therapist, to work on balance, strength, gait, and then in our secret room, we can work on all the other stuff, right? The more private things. And I mean, if there's a limit in time, we can work on both. Of course, we're trained in those things. It's just usually sometimes after a stroke, you need a lot of care. And so sometimes two physical therapists isn't a terrible idea. And if you're working on two different things, insurance will cover both.
That's exceptional. We want to get it covered if we can.
Yeah, right.
And if not, it's good to know what to ask for as well, right? You might have a order for regular physical therapy, but I think a lot of people don't even know that pelvic floor therapy existed. Like until I worked here, I didn't know it existed. And then a lot of people, as they age, have trouble making it to the bathroom in time. So what would you say is a myth that you would like to bust about urinary and fecal incontinence after stroke?
I would say with or without a stroke, a lot of people think that it's normal to experience loss of bowel or bladder function as they age, especially with like laughing, coughing, sneezing. But although it might be common, it is not normal.
Now, then what in the world does common mean if it doesn't mean normal?
There is an increase in prevalence with age and with having babies or doing a lot of manual labor, but it is still not something that you should be expecting to experience or that you can't get help with.
Okay, so in other words, there's hope to make it better.
Yes.
If you're experiencing it, doesn't mean you're stuck with it forever, whether or not you had a stroke. Yeah. If you get it treated effectively, then you can get better.
Yeah. Yep. You got it.
And that can be really transformative because what have you seen can be some of the impacts of that incontinence on people's life? Does it keep them from doing things that are not necessarily tied to the bathroom?
Right. So in general, I would say incontinence, and this is a true statistics, incontinence is the number one reason women specifically end up in nursing homes. And obviously not for a direct reason, but a lot of indirect reasons. One being it's harder to take care of someone who's incontinent. Another reason being that incontinence can lead to infection, an increase in urinary tract infections. And when you're elderly and you get a urinary tract infection, it often leads to confusion, and people have an increased chance of falls with that. So then we have an increased chance of fractures, bruising, all kinds of things, right? And so all those different reasons, depending on your level of care after one of those episodes or who's taking care of you, then there is an increased chance that you'll end up in a nursing home, which no one really wants to be in. So,
Yeah.
yeah.
Wow. That sounds like it's something upstream that can be dealt with that can then prevent so many things that we think of as common, like you said,
Yeah.
with aging,
Right.
like almost inevitable,
Right.
right? You see it so much that's like, oh, well. And then we look at the people who are like independent into their 90s or
Yeah.
100, and we're like, they're the outlier.
Right.
But from what you're saying, it sounds like it could be a lot more
Yeah.
common
Yeah.
to be more independent and not have those
Yes.
things. So, did that surprise you when you started learning about pelvic floor therapy
For
in
sure.
school?
Yeah. And
Or
I'm
after
like,
school,
no,
right?
I learned about pelvic floor physical therapy in PT school, or
You
right
did.
before it, I guess. And then I got out of PT school wanting to do pediatrics, which I do pediatric bowel and bladder as well. So that's a whole nother ballgame. But yeah, I think my first boss was a really good mentor and taught me a lot of just surprising facts, yeah, that I didn't know and that women don't talk about, right? That we don't often feel comfortable sharing with our friends or our neighbors or people who might be able to help us or point us in the right direction. Like, oh, hey, I had pelvic physical therapy. That might be something that can help you, right?
Right.
Or people are fearful of coming to see me because they don't know what to expect.
What have people verbalized to you that they were afraid might happen when they're there that you were able to
I think they're afraid
prove?
of talking about something embarrassing,
Okay.
talking about things that are really just hard to talk about, especially if it comes to like pain with intercourse. And there's just so many layers to that. I think they're afraid of a pelvic exam. They don't know what to expect in regards to a pelvic physical exam at a physical therapist versus at the gynecological exam. And when women get older, they think they're done with that. They're like,
Yeah.
oh, I'm done with pelvic exams.
Right.
And then all of a sudden, here you are again, having to have a pelvic exam, right? So, and they don't know what is normal in regards to like external genitalia aesthetics, right? What does it look like down there, and what does mine look normal? I feel like a lot of people say, "Does mine look normal?" Right?
Yeah.
So it's just, yeah, they're embarrassed, I think, or
That
they don't
makes
know what to
sense.
expect.
Well, as far as are there many differences between your gynecological exam versus OBGYN when they go for a pap smear?
I like to think that it's different. I use real sheets. I know, no paper.
Okay.
And there's no speculum and there's no stirrups.
That's fair.
So one gloved finger, right? Because I'm checking the muscles. I'm really not interested in your organs. I mean, if they're there and I think they're causing an issue, of course, we'll address that. But in the exam, I'm mainly looking at your muscles. So I want to see if they're tender. Are they atrophied, which means are they really weak? Are they feeling strong? Can you squeeze those muscles, relax those muscles? Can you bear down like you would to have a bowel movement? Can you squeeze and hold them for endurance? And can you squeeze and relax multiple times? Like if you had a bunch of sneezes in a row or had to run from a bear.
And that would be like Kegels, right?
Yeah, those are Kegels. Yep.
Yeah.
Or Kegels.
Kegels.
I had a German patient correct me.
Oh,
Kegels, guys.
Kegel.
Kegel.
Is it named after somebody German?
Probably some German man, I would
Okay.
assume.
Ha! Not his wife? No.
Yeah,
Okay.
yeah, it should be his wife.
Definitely his wife.
No, I'm pretty sure it was him.
That's how those things go
I
sometimes.
know. Yeah.
So you teach people how to do those effectively and what's best for them in order to, and does that help with other things like prolapse and things like
Yes,
that?
for sure, which I think is a really great thing to learn as you're aging. Because even if you didn't experience prolapse in your younger years and you are still really active or you've had difficulty with pressure management, which signs of that would be like a hernia, or some people are familiar with diastasis recti, where like the two parts of your six-pack abs are kind of coming apart, stretching apart a little bit, which is really common after having babies, or if you have more of a beer belly type belly. And so any of those things kind of point to maybe you're having some difficulty with managing an increase in pressure in your abdomen, which if there's an increase in pressure in your abdomen and your pelvic floor isn't strong enough to meet that, then we have pressure downward, right, towards our vagina and our anus. So then we're pushing our organs down. So that's a lot more common in women than men just because of the vagina. It's a bigger opening, right? They don't have an opening that large. So I would say definitely some stronger pelvic floor muscles, especially endurance, can really help decrease prolapse.
And I think there's a lot of older women who may not even be familiar with routine things to us that might be like pessaries.
Oh, yeah.
Could you talk about pessaries and what
Sure.
they're for?
Yeah. So a pessary is something, I like to describe it as an orthotic. So a lot of people are more familiar with that. So an orthotic is an insert that you put in your shoe to support your arch. A pessary is a device that you put into your vagina to support your bladder, your rectum, or your uterus. They're most often and most successful for a bladder prolapse, which is called a cystocele. So they just help hold it up. There are a lot of different kinds, different sizes. So I would say the number one difficulty is just finding the right one and sticking with that process of finding the right one, which can be difficult. Sometimes, depending on who you see to get fit for a pessary, they might have limited options, right? So,
Yeah.
but it's definitely an option.
And I think there are some over the counter as well, right?
There are some options. There's something that you can buy. It looks like a tampon, and you put it in and you like push the little device up and it kind of springs open and it can support your bladder a little bit. So
And
those,
it's easy to put in and out like a tampon.
yeah, has a
Yeah.
little string. Yeah. So
And then just for my own information, because I'm not sure, is it more likely to have a bladder prolapse if you've had something like a hysterectomy, or are those not related?
no, that's a great question. So if you've had a hysterectomy, you are more likely to have bladder or rectal prolapse only because the space that your uterus was taking up is no longer being filled. And so if tissues are already weak or lax, then you may have your bladder or your rectum fall to fill that space.
Yeah.
Yeah.
And so would someone who has not had a hysterectomy be more likely to have a uterine prolapse where their cervix is coming down and
Not
being in the way?
necessarily. No,
Okay.
I would say though.
It depends on the muscles that are
Yeah,
being
and
affected.
what's happened in your body, right? But I would say a bladder prolapse and a uterine prolapse are the most common. Yeah. And pessaries are most successful with those as well. So a rectocele is a little bit more trickier.
Yeah.
Yeah.
So is there a difference between what people can do for their pelvic health if they're a man or a woman?
Yeah,
After a
so
stroke?
the muscles are generally exactly the same. But kind of like we talked about already, women have an increased chance of having issues, not only because we do have babies,
Mhm.
but also because we have that vaginal opening and things like to take the path of least resistance. So since there's that opening, it just makes more problems, right? It's like a bigger hole in the hammock, if you will, right?
Right.
Yeah. So more vulnerable for things to fall through, and it's a little bit weaker in general. But men tend to have issues with like a prostatectomy. So when that prostate is actually closing their urethra. And so when they take the prostate away, they realize that they are incontinent and their pelvic floors are not as strong as maybe they thought because it was actually their prostate keeping them continent all along. So they often need physical therapy for those reasons to actually strengthen their pelvic floor, which is you would actually do pretty similarly. It's not always necessary, but if necessary, a male pelvic exam would be through the anus.
Okay.
Yeah.
And then if someone is having issues with incontinence, whether it's urinary or fecal incontinence, but they live far away or from a pelvic floor therapist, because I mean, you guys are slightly rare,
Yeah,
right?
yeah.
Yeah.
I would say it's getting better,
So
but
is there like a telehealth option for people, or are there things that they can do at home to strengthen their pelvic floor?
yeah, so we have telehealth, and most places do now. And a lot of people's insurance actually now are providing their own telehealth services. So you can always check with your insurance to see if they have pelvic health telehealth through your insurance. But I would also say at home, usually as we age, we need more strength, right? Now, that's not always true. The benefit of going to an actual pelvic health physical therapist is we can actually assess your pelvic floor and tell you if it's tight or weak and what you need to do about that. But I would say in general, most people are going to be on the weaker side, and we can assume that fairly safely, especially after menopause. We lose estrogen and our tissue and our muscle get weaker, unfortunately. And so with that, you just want to be able to do those Kegels, which I always tell people, pretend you're picking up a blueberry with your vagina and then set it all the way down, right? And so you can do some quick ones, squeeze, rest, and then some long ones to work on that endurance. So hold 10 seconds, rest 10 seconds.
And do you teach men to do
Oh, yeah.
Kegels too?
Yep.
Like, what do you describe it as
Good
for men?
question.
Okay, I guess they just know how to do that.
Yeah, they all go, Okay, gotcha.
Okay, well, that's good to know.
I know, right? Yeah.
But see, that's why she's a professional, because she knows these things.
Yeah, and I think it's important to remember to breathe when you're doing hard things and to tighten your pelvic floor when you like push, pull, lift, exhale and squeeze. And then when you're coughing, laughing, sneezing, you can also kind of retrain those muscles to help during those times, right? So squeeze when you sneeze is what I say, but also laugh and cough.
That's true.
Yeah.
And we need laughter. We need to be
Yeah.
able to participate in activities. So I know a lot of people experience isolation after a
Yeah.
stroke because they're not able to do their normal activities. And even if they don't have any deficits, is what we call it, when someone has those residual effects after a stroke, maybe they still have a face that is droopy on one side, or one side of their body isn't working, and you can see that. But then there are a lot more people who have had a stroke whose symptoms are invisible to those of us on the outside, especially that don't live with them every day. And I feel like this incontinence can be one of the more invisible symptoms that people outside of you may not be as aware of if you're able to
So
keep it
true.
secret. But
Yeah.
do you feel like that, or have you seen where that keeps people from their social life?
For sure. Yes. I feel like people are fearful, right, of um, having any type of peeing your pants, pooping your pants, right? Which, I mean, I don't blame them.
That's valid.
And sometimes you have these episodes, especially with fecal incontinence, where it happens and you don't know it.
Ooh.
And that makes you really fearful that you're going to have poop in your pants and other people are going to smell it and you're not going to. And so we have a lot of also, like Amazon products we recommend, I feel like that can be helpful in some of those situations. Obviously, we're hoping in the long term you don't need any of those products and that you can use your muscles to help with the situation. But also just like tips and tricks, right? On like
Good.
getting to the bathroom on time and things like that you don't even think of, like your diet. How can your diet be affecting this issue in a way that you might not have had to think of before? So like bladder irritants, carbonation, artificial flavoring or coloring or sweetening, those can be bladder irritants. And alcohol, did I say caffeine? Caffeine.
I don't think you said caffeine.
Yeah.
I was expecting caffeine first,
it's
and then
on
you're
there.
like carbonation,
Yeah.
artificial sweeteners. I'm like, so all Diet Cokes?
Yes, all Diet Cokes.
Oops.
Yeah,
Okay.
yeah. Caffeine is definitely a big one.
Sure.
And then, I mean, some foods, even like spicy foods or citrusy, acidic foods. I was always surprised strawberries are really acidic. I know, boo. So
They're acidic,
Yeah.
but they're wonderful.
They're so good for you, yeah. So, I mean, it just depends on if you're having a problem. So I tell people, I'm not telling you not to have those things. I'm just telling you to, if you're having incontinence, to like look at that list and say, maybe I can reduce some of these and see if that helps, right? Because those can make your bladder mad, which makes it spasm and you lose pee uncontrollably, right? Or it gives you like an urgency feeling like I gotta go and I gotta go now. So that's a problem, right? And then pooping changes as we age and can change after a stroke as well. And so working with someone who is able to help you manage that, and especially on a weekly basis, we get to see you a little bit more often than maybe your physician. And so we can kind of help manage, what do you need? What do you need to take away? Do we need more fiber? Do we need to like add in a magnesium? What does that look like, And is it working? Is it not? What do we need to change? So I think that's one really nice thing about a PT is you see them often and we get to spend a decent amount of time with you so you can adjust things pretty quickly.
Well, that's awesome. I feel like that is just a wealth of information that most people don't know to even ask about or think it's an option for them. Like they're like, well, this is just how my life is now.
Yeah.
So thank you for taking the time out of your busy clinic day to explain how pelvic floor therapy can help someone after a stroke, whether they're a man or a woman. So please take advantage of this advice if it's something that could help you or a loved one. If you liked this episode of the Stronger After Stroke podcast, I would love it if you could leave me a comment wherever you're listening and let us know what was helpful, or let us know what else you'd like to hear about. If there's another subject we haven't even covered yet, and we can look for another expert.
Yeah.
So make sure you like and subscribe wherever you are listening from, or if you're watching on YouTube, and I will see you in the next episode.
Thank you.